Go.
The disorder that our group picked is obsessive compulsive disorder, also known as OCD. And my name is Gianna Jones.
I'm Shannon McDonald.
And I'm Courtney McDonald.
We chose this disorder because we found it very interesting and we want to bring awareness to the surrounding communities. What is OCD? OCD is a common, chronic, and long lasting disorder in which a person has uncontrollable, reoccurring thoughts, obsessions, and or behaviors which are compulsions that he or she feels the need to repeat over and over. OCD can affect many parts of a person's life, such as school, work, friendships, and other relationships.
There are 4 different types of OCD: checking, contamination, symmetry and ordering, and ruminations and intrusive thoughts. Checking is when you have to check something multiple times. This could be making sure your doors are locked or seeing if your straightener has still been left on. Contamination could be the physical fear of being contaminated with germs or being around germs, or it could be mental contamination. So, if someone has done you wrong, running into these people may make a person triggered. Symmetry and ordering is doing things such as color coding items or making items go all of the same direction. Ruminations and intrusive thoughts can be when an individual has negative thoughts about harming someone else being harmed, or intense thoughts of perfection.
Signs and symptoms of OCD: the fear of being contaminated by germs or dirt or contaminating others, thoughts of harming yourself or others, like Courtney was just explaining, excessive focus on religious or moral ideas, or the fear of losing or not having things you might need.
OCD has a big impact on about 1 in 40 adults in the United States. There are about 1 in 100 children and or teens that are living with OCD. And African Americans have the highest risk of OCD. This is mainly based off of their childhood and how they grew up. Usually, OCD occurs between the ages of 15 through 44 and is usually diagnosed by the age of 19.
Some negative effects of OCD. In general, people with OCD can't control their behaviors or their thoughts, and they spend about an hour a day obsessing over these ideas, which can cause many problems in their daily lives. The easiest way to deal with this situation is to avoid the triggers, but some people also turn to drugs and alcohol to help relieve their anxiety. If left untreated, OCD can lead to depression and worsened anxiety.
Some risk factors of OCD: genetics. So, if your parent, sibling, or child has OCD, you're more at risk. The environment, although further research is needed, there's been connections found between OCD and childhood trauma. And there's also links between stressful events in your life and they increase the rate of anxiety. More risk factors of OCD: they're generally out of control because they're genetic or come from childhood trauma that we can't necessarily avoid. I think that talking about childhood trauma and its effects could in turn reduce the rates of OCD because a child wouldn't have as many things to trigger them. Spreading awareness to everyone can help communities learn about OCD, what it is, and how people can deal with it that are affected by it. And getting people therapy who are affected by this disorder can help them live better lives while not being affected by their symptoms.
OCD can only be diagnosed a few ways, the most common being psychological evaluation. This is basically when a patient goes in and tells the doctor exactly what they are thinking and what goes through their mind, and basically the activities that are taking up their time throughout their daily life. There's also the diagnostic criteria for OCD, which is when the doctor looks at the patient and can sees if they can clearly tell exactly what they're thinking, and they can also see if they have any other symptoms such as throat clicking when they are being diagnosed. The last diagnosis is physical exam. This is Basically, when a person has actual marks on their body showing their OCD being shown, which could be their hands being raw from washing them too much.
So OCD is not something that can be diagnosed by some sort of medical test, biological blood test, or genetic test, or anything like that. It needs to be diagnosed by an interview with a skilled clinician. And I guess everyone to some extent has some symptoms of OCD. It occurs naturally in the environment on a continuum in the population. And so when the symptoms get to the point where it's getting in the way of functioning or causing a great deal of distress, taking up a great deal of time, that's when a clinician would say, okay, you meet the criteria for having this diagnosis.
Some forms of treatment of OCD include serotonin reuptake inhibitors or SRIs, which are used to treat symptoms of OCD. Psychotherapy is also a very positive way to help those with OCD. The most common is exposure and response prevention, which forces the person to spend time in a situation that triggers them, but takes away their release, like their result. Um, an example of this would be those who are um, obsessed with like germs will, if they come in contact with germs, they typically respond by washing their hands. So they would put the person in contact with germs, but not allow them to
Mm.
wash their hands. And the purpose of this is to force the person through their compulsion in an attempt to decrease the compulsive behavior.
As an adult with OCD, most realize they're doing things out of the ordinary. This is interesting because with a lot of disorders, people don't want to convince themselves that they have it. And there are no way to prevent OCD, but getting treatment can help prevent it from worsening. So there's certain therapies you can do and getting treatment so then you don't have to, you can go on with your daily life.
Ways to help those with OCD: don't point out their behaviors, be patient with them, don't go along with their obsessions or compulsions, support the person and be positive, and laugh along with them if they're laughing about their symptoms, because sometimes that's like their way of coping with the symptoms.
Obviously, if somebody suffers from OCD, we always say that not only do they suffer from OCD, but so does the family. And families are always wanting to help, and they really don't know what to do, right? Because if they really try to push the person, it just seems like they're getting really anxious and overwhelmed. And then if they're not pushing the person, it looks like they're just taking over the family. And then there's the whole problem of like the family doesn't understand what OCD is. Because I can use these words, but they don't really have the experience because they're going like, well, that makes no sense. But if you could get your family member to watch this, we can give them the experience of having OCD. So right now, what I would want is that if somebody's watching this, I want them to get a pencil and paper and to actually do that because it's critical that they don't just listen to this. So go get a pencil and paper. All right. So you have your pencil and paper, and what I'd like you to write down is a sentence. I'd like you to write down that I want, and write the name down of somebody who's really dear to you, who you love, and do that. And now I want you to write down to die a horrible, painful death. Now, I don't know how many of you followed this instruction, but what we find most of the time is some of you will not have written it down. Some of you will have written it down and maybe you want to tear it up. And I would ask you, either of you, why didn't you write it down? Why do you want to tear it up? We've offered you this opportunity to understand the problem and you're wanting to do something about it. And so when we ask people this question, they'll often say, well, it's a horrible thought. Do you think writing down is going to make it happen? Why would you want to tear it up? Is that going to make it go away? Right? The thought's still there. What is bad about having it written down? Or again, why wouldn't you write it down in the first place? If you wrote it down, would you be willing to carry this paper in a wallet for a week? And if you say to me no, then my question is why? And the answers are often like, well, somebody might see it in my wallet. My question is, how often do people go in your wallet? What if my loved one sees it? Well, can't you tell them you were doing this exercise? So, in this little exercise, if you really did this, what you find is this made you uncomfortable and you don't have OCD. You'll forget this in an hour. But if I suffer from OCD, this is my life 24/7. I don't get to walk away from it. So next time when you're saying something doesn't seem rational, remember how this made you uncomfortable and you don't even have the problem.
When we interviewed the individual, they had stated that they had multiple types of OCD. The individual told us that they typically struggle with counting in regards to doing things such as taking steps, washing their hands, or even touching something a certain amount of times. They also check things a lot, like seeing if the door is locked or making sure the straightener is off. The individual experiences these things on a daily basis, which affects their life constantly. Personally, having OCD, I also have both of these types, but I also have other types. Mental contamination is one of the strongest things that I have. So basically, if someone does me wrong, then when I see them, I will get triggered and start to have anxiety. I also have ordering. So right now, my closet is currently all color coded. And I often make a clicking noise in the back of my throat when something is overwhelming me. I'm currently on medication, which has been found to help me a lot.
So this is the poster that our group decided to make. Um, it shows that OCD is not just being a neat freak. Just because you're a neat freak does not mean you have OCD. Being organized is normal. You shouldn't try to diagnose yourself with OCD when it's much more than being just tidy. It also shows to stop like romanticizing OCD. If you ever find yourself saying, "Oh, I'm so OCD about," you should stop because it's not an adjective. It's the same with anxiety and depression. You shouldn't say you're depressed and anxious because they're actually disorders that people have. It's a real illness and it's not a joke. So it shows awareness to take it more serious.